Thank you to the organizers for inviting me to talk about this study that we did a couple of years ago in the 2014-2015 Volvo Ocean Race. And I'm inspired to talk about it thanks to the previous speaker. I think I'm going to address some things that dovetail quite nicely with the potential for AF risk. We didn't look at AF, but we try to do some longitudinal studies in these athletes, not over long term, but over the medium term of a high intensity stress exposure during the race, and then also to see look at some other factors, not just the athleticism, but we suspect there are other factors beyond the physical exertion that contribute to this. So the study we did has the title Left Atrial Response to Long Duration Stress during around the world sailing in the Volvo Ocean Race. And this was led by my colleague Stefan Brandt from Uppsala. And it was supported in a minor part with unconditional funding from Alva Medica. And here's a little bit of a video to introduce it.
Something that's really unique about the Volvo Ocean Race is the amount and the duration of stress that the sailors are exposed to. And that's a unique model. I don't know that we have any other situation in the world where humans are exposed to that intensity combined with that duration of stress. And that gave us a unique opportunity to look at the effects that stress might have upon the heart.
So I'm going to stop the video there. And so the Volvo Ocean Race goes on for just over 4 months at sea. I'll get to some of the details, but typically they'll be at sea for a number of weeks for each leg, and they'll be on a 4-hour schedule of 4 hours awake and 4 hours of rest around the clock, typically for several weeks at a time. So it's an immense amount of stress that they're under, not necessarily physical, but certainly psychological. And so it's an excellent model for long-term stress. And Stefan Brandt has previously shown in his PhD thesis work that there is a metabolic dysregulation that occurs over these 6 months. There's an increased amount of abdominal fat. There's at the expense of muscular mass. There's an increased blood pressure, an increased heart rate. And these previous findings of cardiovascular relevance inspired the study that we then embarked upon. So the aims were to evaluate the effects upon the ECG and echocardiography in athletes exposed to long duration stress of this kind. And I want to stress on the fact that they are, when speaking to colleagues, they're sailors. Yeah, they're sailing. They're just taking it easy. No. These are top athletes performing in spurts at peak physical performance, in addition to the psychological stress components. We studied one boat with 9 healthy male athlete sailors, mean age of 32 years. Here we see the team. We had to set up these very high efficiency throughput at each port. So we studied them at baseline, and then at each port as they came in. When they came directly off the boats, they would have to go to the port immigration services, and then directly to us before they got to their hamburgers and beer, which they very much were looking forward to. So this is the race as we followed them, as presented in this data here. It started at Alicante in Spain. That was at time 0. And then they crossed the Atlantic and kissed Brazil without getting off the boat, or rounded a buoy, actually, literally there, coming down to Cape Town about just over a month later, with constantly 4 hours, 4 on, 4 hours off rest and active schedule. Then going on to Cape Town, another approximate month and some change up to Abu Dhabi in the United Arab Emirates, an additional month and change over to Sanya in China, and there we also had data after 1 week recovery. So we had start, the couple weeks at sea, in Cape Town, a couple weeks at sea in Abu Dhabi, a couple weeks at sea in Sanya, and then one week recovery. They typically would have had 1 week recovery in each of the ports, but this is the only data point we had for recovery. For logistic reasons, they continued on to Auckland, and then off the map here around to South America, up to North America, and across to Europe, finishing off in Sweden just over 6 months later. We terminated this study at this point for unrelated reasons. So the methods, we acquired a 12-lead electrocardiogram digitally, and we performed echocardiography with the GE VividQ system to evaluate structure and Doppler measurements. And we did the measurements after the fact in a core lab, blinded to time points and individuals. Interestingly, my background is in cardiac MRI, and I was originally contacted by Stefan, and he said, "Oh, let's do MRI in each port." I said, well, we could do that, but there's a lot of particularities to MRI and the kind of things of tissue characterization we might want to do that are very particular to the vendor and software types. How about we do ECG and echo, because we could bring it along in a backpack? So that's how we sort of ended up with these endpoints out of a practical necessity. So the echo measures we looked at were the atrial areas and systolic areas, diastolic transmitral flow pulse wave Doppler, and systolic and diastolic myocardial tissue Doppler velocities. I'll only be showing a portion of these. But here were the results from the electrocardiogram with regards to P-wave duration. And you can see here on the horizontal axis, we have the start in Alicante, and then arriving after the first leg, arriving after the second leg, arriving immediately after the third leg, and then 1 week recovery. And we see a progressive prolongation of the P-wave duration in milliseconds here from 94 up to 104. It's only about a 10 millisecond prolongation, but we see it. It's statistically significant, and there's also this recovery which occurs during that 1 week recovery session we had. One can imagine that there would be a recovery going on each time after the arrival in each port, which we didn't catch. But interesting, we see these dynamics of a progressive increase and then the ability to recover in as short time as 1 week. So this is the P-wave duration on the electrocardiogram. And then by comparison, here we have on the vertical axis the left atrial and systolic area in square centimeters from the echocardiogram. We did not perform any more advanced strain analyses or the sort. But here again we see an increase that accelerates up on the third leg, the cumulative effects of the stress presumably, and then a recovery change on the order of 2 or 3 square centimeters. It's not enormous changes, but certainly statistically significant, and something that parallels the electrocardiographic changes. To look at it a little bit more in detail, so what could be happening here is the diastology that's happening. Well, we did have access to the deceleration time. So this is on the vertical axis, the change in the E-wave deceleration time between arrival in port on the third leg and the start, and that had an inverse relationship with the change in the P-wave duration during that same time period. Equally so, that also varied with the change in hematocrit during that time period. So one can imagine potentially hemodynamic effects contributing to these factors, although this is more of a speculative evaluation. So in summary, these athlete sailors were exposed to long duration stress of this race, and they showed transient increasing P-wave duration and left atrial enlargement. And this suggests that extreme stress leads to temporary and resolvable changes in atrial size and conduction. And the stress of the around the world sailing racing has electrophysiological effects upon the atria, similar to those that have been shown in high altitude exposure or running a marathon. And I think this sort of complements the knowledge base on the physical exertion side with the psychological exertion, if we want to call it that. There's in the blood work, we see an enormous hormonal stress levels that are associated with these activities. And maybe you were talking, the previous speaker, about the relationship between amount of physical exertion, number of hours of training. But this sort of, in my mind's eye, this shows us a little bit of a proof of concept of the role of stress in this, and one can extrapolate it potentially to the stresses that we have in our most stressful working environments, potentially. And with that, thank you for your attention.